Hello, my name is Patrick George. I am the Veteran Service Officer for the City of Watertown, and I am joined today by Jay Gorman from the Bedford VA. Jay, why don't you tell us a little bit about yourself?
Sure. Thanks so much. I'm a clinical research psychologist with the New England Mental Illness Research Education and Clinical Center. And I'm the education director there up in VA Bedford Healthcare System. Um, so, One of the things that I try to work on is improving social connection in the community. And some of the work I do is around community engagement, social reintegration, and especially, working with a program that's helping to decrease loneliness and isolation among veterans around the country.
Great. And I know we've chatted a bit, and I know I worked with some of your colleagues at the VA in Bedford as well as we've sort of tried to get this coffee social rolling here in Watertown. And I know, as you just mentioned, sort of combating isolation amongst veterans. I know I think it's a mystery, or even just talking to people, it can be difficult to really define what loneliness is. Can you kind of give us some talking points or give us some ideas of how that's actually measured sort of in layman's terms so that we can
Sure.
share with families and friends as well?
Yeah, absolutely. And maybe I'll talk about a couple different concepts within that. This isn't just a crisis in the veteran community,
Right.
right? We sort of have an epidemic of loneliness. The Surgeon General kind of declared it actually right before the COVID
Wow.
pandemic, and so it's really only gotten worse since that. And so when we think of loneliness, it's a feeling, like a subjective feeling, that we have a less social connection than we want, right? That's a feeling. And when we think of isolation, it's objective, real time lack of social interaction. So someone's like someone. So I just to review, right? Loneliness is the subjective feeling, the perception that we just don't have the social connection we need in our lives, and isolation is the real time social interaction.
The coffee socials that we've talked about with the Bedford VA, we're
Yeah.
finally hoping to bring these to Watertown, and we're kind of putting everything together between the VA, between the Watertown Housing Authority, and Watertown Veteran Services. And I know, we're trying to coordinate with veterans who maybe don't utilize not even just veteran services, but maybe just aren't as upfront about their military service. And I think really the effort that we're trying to do here is sort of put it where the veterans we think are, and the Watertown Housing Authority is a huge partner in terms of social services, not just veterans, as you mentioned. And so we're really trying to work towards putting that in there. And so, can you talk a little bit more about what a coffee social entails from the VA's perspective? What the staffing is, sort of how the discussions go, if they're
Sure.
guided or not.
Yeah. So often when we think of sort of veteran socials, so they can take a lot of different forms, and they do often start with, as you're pointing out, like a cup of coffee, right? And so we think of them as veteran-led, community-based social groups that start in the communities for veterans by veterans, and they're often started. They can be started with a veteran leader in the community, or a veteran peer specialist. So, peer specialists are employed by the VA. They're veterans with a lived mental health or substance use experience with training, and they often help start, initiate, host, and sustain veteran socials. Um, and so, Peer specialists, along with other veteran leaders in the communities, have started this to kind of enhance social connection in the community, and just a place where veterans, where they live, can meet other veterans and enjoy and connect and spend time with themselves, with each other. It also lets communities know, like, hey, we actually have veterans here, and this is where they are,
Right.
and they connect. So there's a lot of a lot of positive things going on across the country, and it's really taken off. There's 134 across 25 states
Wow.
and territories in the U.S. Um, that is generally how, we have sort of a veteran champion, and they help take on that responsibility, and they're either weekly or monthly.
So for coffee socials, the whole point really is to build connection, and what the effects are for that. Can you talk about what social connections are, how that affects us from a mental and physical health perspective?
Sure. So social connection itself is really an umbrella term that sort of talks about the size and diversity of our social network. And we think about it with three concepts. We think about it as structure, which is how many social contacts do we have and with whom? Is it a friend, a work colleague, a family member? We think about it with function. What does this social connection do for us, with us? Is it someone that provides us with emotional support? Is it a mentor? Is it someone who helps us get to an appointment? And what's the quality, right? Do we perceive it as helpful, unhelpful? Does it feel positive, or are there negative qualities to it? So that sort of makes up what social connection is. And it can have a lot of different impacts on our health. One thought is that social connection helps to regulate our stress response system. And so without enough of it, we are sort of unregulated, and stress can do all sorts of nasty things to our body and our mind. When we look at data and we just look at, let's say, isolation and loneliness, if we are isolated and lonely, it can increase our risk of early death by 29%. And not only that, but it has all sorts of it's associated with all sorts of challenging health impacts. So heart disease, stroke, dementia, anxiety, depression, suicidality, diabetes, and different diabetic complications. And so, it can really impact a lot of different aspects of our health, both physically and mentally.
Wow. And yeah, as you mentioned there, a lot of those conditions that you talked about are conditions that happen to be, unfortunately, side effects of Agent Orange exposure with our Vietnam era veterans as well. The specific cardiac conditions you mentioned, type 2 diabetes, and those other, some of the other health conditions that you mentioned there. And so I think from a target audience perspective, I think it makes a lot of sense for our coffee socials to be interacting with those folks. I think hopefully as a way to demystify really the access to the VA healthcare system and the different supports that are both there for them at the VA hospital, and then through veteran service officers like myself that can help them through a VA claim and really kind of help them receive the compensation and that's going to support them and allow them to sort of continue to enjoy their lives as they move on. Yeah. So can you talk a little bit more? Obviously we've got 25 states, as you said, and over 100 socials across the country. So there must be some type of success stories you're hearing from there. Is there additional sort of what information are you gleaning from these events that are sort of helping create more of them?
Yeah. So when we think about who we're reaching, right, we're not only trying to reach those who are enrolled in VA, but these are people who are also not enrolled in VA services, or these are also individuals who are just military affiliated, right? Family, caregivers, survivors. And so, really the goal is to foster social connection within communities where veterans live. And so one of the things we see from surveys we see that 75% of individuals who join a veteran social at some point have social contact with those people outside of the social. So this idea that we have these events and they've increased their social support system or increased their social connection. And I'll talk a little bit we can talk about social connection soon, but and so 75% are incorporating someone. And most, right, 55% or so in general, meet someone there for the first time and then spend time with them outside the social. So not only are they maybe bolstering connections they may already have, but they're forming new ones.
That's great. We always joke about Watertown being small size-wise. It's only about 4 square miles. Then there are a lot of people that know each other, grew up in this community, but there's certainly newer people that come in the city especially through the housing. And everything else. So it's good to sort of have that ability to build those new connections and, really not be a stranger with your neighbor, especially in a facility where I know our coffee social is going to be here. I know a lot of family members, a lot of veterans don't utilize a VA at all. And sort of, I hope that in a circumstance right here where we sort of can bring them, bring the VA, bring the VSOs to the veterans in the, through this coffee social is really going to help sort of get a veteran more comfortable to utilize the VA system and the services that they're entitled to that they've earned. So.
Yeah, often, when we think of these veteran socials, what they can do also is they really provide an avenue for people who maybe are curious about the VA but don't have their services there yet. And you meet veterans who do use the VA there, and you can talk candidly about the challenges or about the pros and cons. And so, you get to meet other veterans who are using VA services and other veterans who aren't. And, obviously with Agent Orange, the VA has really a specific expertise in that, right? You're as doctors there will see a lot of individuals that have been exposed. And so they get a lot of knowledge on that. And so, when we're thinking about, the best, soonest care for a specific concern and challenge that it disproportionately affects veterans, right? I'm biased, obviously, but
Yeah.
the VA is a place where you will get that type of expertise just for the sheer numbers of individuals that are seen there, yeah,
Right.
and the expertise that are sort of gained through that.
Perfect. And so I social media wise, I like to brag because I like to I get a lot of calls from Watertown, New York, and Watertown, Connecticut when people start looking up Watertown Veteran
Okay,
Services, and
sure,
they get a hold of me. I also understand that Watertown, Massachusetts is not the hub of all veteran services things. So I know as we're starting our coffee social here, I know our coffee social starting on January 8th in Watertown at 100 Warren Street at the community conference room there. Can you talk about how many other coffee socials there are in Massachusetts?
sure. So there are 12 veteran socials in Massachusetts throughout the area. They're in, I'm sure we'll put a graphic up, but they're all over. And these are veterans in their community who decide they want to provide a space for other veterans to chat. They want to meet other people, and they want to improve their community's capacity to serve veterans. And one of the ways to do that is by providing a space so that they can, this can be veteran led, and veterans can support one another, enjoy, or take place in any other activities that they may want.
Great. And then as far as the social events go, we talked about the success earlier. About 75% of individuals that show up to these events sort of carry on. Have they sort of started their own coffee socials and they're moving on to bowling leagues and everything else?
Sure. So we see a couple things depending on different geography throughout the
Yeah.
country. It turns into different things, but we do try to have the veteran socials. They're always open. So, but one of the obviously the big metrics I just talked about was, hey, do you do things outside of this with other people? And so it's very much encouraged. People have barbecues. People do volunteer activities. People join. I mean, there was a veteran social where everyone learned to scuba dive. There was a veteran social where everyone started volunteering at gardens at the farming. There's been many where outside where people do form their own bowling teams and do something outside.
Wow.
And so there are several where people start gaming together. So these are we may start with a cup of coffee,
Yep.
but they're really driven by what the attendee preferences are and what where the community wants it to go. It is the communities, right?
Yep,
This
of
is
course.
not as a VA, we love to support things, but this is we want to support it, but this is the community's activity and this is their social,
Yep.
not ours. Yeah.
Great. I know this is timely as we're heading into the new year and everyone's got resolutions and all those other items. And I know one of the ones from a couple of years ago, and we've talked about this a bit today, is sort of learning a new skill as a way to sort of combat some of dementia, Alzheimer's related conditions. And I think the premise of that really, right, is the brain is a muscle. And I think a whole idea behind this coffee social and sort of building new social connections is utilizing that muscle, right, and communicating a little bit more with people that you maybe never communicated with. Um, but I also think the value of someone who serves is you really have this built-in set of questions that you can ask somebody, and that you don't even need to know them for more than 2 minutes to sort of start that process, right, and really get the ball rolling in terms of what branch were you in, when did you serve overseas, what base were you on, those kinds of things. And so I think this is really a great opportunity to really start and get the ball rolling, and then allow them, as you've indicated and as we've talked about today, to find their niche. If it isn't just coffee, if it's if it's somewhere else, to play golf or go bowling or anything like that. And so I really think it starts here though, and allowing the veterans in the community to understand that there is a place they can go and at least start with a cup of coffee and find somebody that they maybe didn't know or haven't seen in a while. Maybe this is a smaller community, and I know I get a lot of calls from veterans who grew up in Watertown, lived in Watertown, moved away, and now they're coming back to Watertown. And so I think this is a really great opportunity for us to sort of coordinate and work with our partners in the community and have a successful event.
Yeah, and I mean, the premise that you really put, I mean, obviously working with community partners, businesses, local organizations, institutions. I mean, veteran socials wouldn't be here without that type of partnership, and it's vital. I mean, it really is, to forge those and to move forward. Um, one of the things you pointed out, and I'm just thinking, how social question affects us. And often I think about it as if it's like food or water, right? Without enough of that, you really get depleted. And it's kind of the same thing with social connection, right? Without enough, your body you don't feel good.
Yep.
And it's complex how loneliness and isolation affect our health and mental health. One of the theories I like is called like the social homeostatic model. And what that essentially means, is one of the ideas is that social connection, really is sort of is part of it, relieves our stress response.
Okay.
And so, as most people know, many people know, stress can wreak havoc on our brain, on our body, on our mind. And so if we don't have enough social connection, that stress response keeps going. That stress response happens. And so when we're thinking about, what do we do? What do we do to relieve that stress response or to inhibit it?
Yep.
Right? It's, well, how do we start places in the community where people can go and connect with one another? And so, that's sort of one of the reasons we keep sort of forging these relationships with individuals like yourself and other organizations sort of across the country is that, this is important for health, and important for functioning.
Great. So I think it makes sense to close down now. And something I want to reiterate again is our first coffee social in Watertown is going to be January 8th at 100 Warren Street, which is in the community room, the conference room at the Watertown Housing Authority, from about 10 to 11:30. And that's going to be once a week at that location. If we're successful here today and we get a lot of people interested outside of Watertown, how can they sort of start if they decide, oh, this is a great idea, but I don't feel like driving all the way to Watertown for a coffee social? How can someone in a neighboring community somewhere across Massachusetts, how can they sort of start their own process here?
Sure. So, there's a number of ways. One, we have a web page with a quick start guide, that anyone can download on mentalhealth.va.gov/socials. You can also contact us. Now, two ways. You can call us at 781-879-6587, or individuals can email us at vhabed voices@va.gov. Voices stands for Veteran Outreach into the Community to Expand Social Support. So vhabedvoices@va.gov, or call that number, or download the Quick Start Guide and get started yourself.
Great.
So either way, we're open to start ones in communities where veterans feel passionate about bringing social connection to others where they live.
Great. Jay, thank you so much for joining us today. This has been one of a few veteran-specific video recordings that we've done lately. And again, I want to thank our partners with Watertown Cable Access for really trying to reach out to the veterans. And a quick conversation we had earlier is not even just reaching out to the veterans, sort of empowering the family members and the friends of people who know veterans and have veterans sort of in their circle. Because again, a veteran is such a small member of the population, but they are everywhere. And so we're trying our best here with all sorts of different outreach models to kind of get not just the veteran, but get enough people interested in what we're talking about here that they can share this kind of information with the veterans that they know. So again, thank you so much, Jay, and looking forward to having our coffee social.
Well, thank you for the opportunity, and thank you for all that you do for the veteran community. This wouldn't be possible without you. So really appreciate all that you do.
Perfect. Thanks so much, Jay.
Thanks.